The saying goes something like this: it's not how much you know, but how much you care that matters to patients. Now, the tough part is, how do you show how much you care when we're seeing patients so quickly? In this video, I'm going to give you one little trick that I personally use to help you connect with the patient that much faster. Hello, my name is John Lin. I'm a urologist in Gilbert, Arizona, also your humble host of the Thriving Urology Practice Facebook group, where we crowdsource practice management solutions for everybody's benefit. I was seeing patients recently, and I saw a couple of professionals, and I thought, you know what, the techniques that I use may be helpful to assist you in better connect with your patients when we're all given a very short amount of time to see patients every 10 minutes, every 15 minutes. So these patients are professionals. And before I walked into the room, my awesome staff has already prepared the chart, the electronic health records documentation. They have done everything that they could to document that encounter, which is the way it should be done, by the way. If you don't have that workflow, if you're not having your staff documenting pretty much almost the entire encounter, and you as the provider simply verifying that information, you should definitely consider implementing that. Actually, CMS in 2019 has said that even the history of present illness can be documented by ancillary staff. You just simply need to verify it. So my staff has already captured all the pertinent information about the history, the HPI, the review systems and medications and things like that. One of the things that they capture is the patient's social history, and within the social history, the patient's occupation. I always go in there and look at that before I walk into the room. I always go in, and after I go into the room, I always supplement that field with the nuances of the actual occupation. For instance, if the patient's a veterinarian who works 9 days on, 5 days off, I might write that down. Or if the patient's interested in a certain activity like golfing or tennis or shooting sports, I will note that in the social history section under hobbies. I saw these two patients recently who are professionals. So one is a dentist and the other one is a veterinarian. And these guys came in. Before I walked into the room, I've already looked at their social history. And so as soon as I walked in, I knew their occupation: dentist, veterinarian. So as soon as I walk into the room, like for a dentist, for instance, he is coming in on a Monday, for instance, I would walk into the room and say, wait, I thought dentists took off Fridays and you're here on a Monday. How does that work, right? So I kind of start off with, number one, I already know what you do. And number two, I'm already able to discuss things in a contextual manner that is typical for the person's occupation. So that is a really, really easy way to break the ice and to show that you connect. You know a little bit about the occupation of the patient. And for the veterinarian, I walk in and I'll say, hey, I understand a lot of veterinarians or veterinary clinics have been bought out by venture capital corporations. Are you running a private practice or are you owned by a corporation? So having a little bit of knowledge in the field that the patient is coming from matters a lot. And in your area where you practice, you know there are certain industries that are nearby. And it would be a very good idea when you meet the employees of these businesses to learn a little bit about their business. And I will tell you, it's come in very, very handy in allowing me to very quickly connect with the patient. And if you can throw in a joke in there, that'll engage everyone's mirror neurons and allow you to be a little bit more creative and makes the patient a little bit more receptive in learning about the things that you are about to share with the patient when it comes to clinical urology. So learning about the patient's social history and then addressing that and discussing that in your conversation with the patient at the very, very beginning of the conversation is one very quick and easy way to connect with the patient. So think about that. If you don't have that employed in your workflow, consider doing that. I found it to be extremely helpful, and it makes that connection a lot faster, makes it a lot easier to interact with the patient, and it it builds that relationship. Right now, everything, as you know, word of mouth is the best way to improve your business. And there's something about having a positive experience in your clinic that makes someone want to share about how good you are. So in the age of press gaining scores and net promoter scores and things like that, something to look into and consider employing and implementing in your practice. Hope you all have a great afternoon, and I'm off to seeing more patients. Take care. Bye-bye.